I want to jump into 18 rehab facilities, and some of which $70,000 a month. Um, is this a failure of the system, the mental health system, that somebody is going in and it's like a revolving door, and the winners, because there really is only one winner, and that's getting $70,000 for a 30-day program that gets repeated and repeated and repeated?
This is just so annoying and so unfortunate. First of all, rehab centers usually refer to treating people who have problems with drug abuse and are addictions, with which Nick seems like he definitely had. However, they don't necessarily provide mental health care for a primary diagnosis such as schizophrenia, which may have been the reason that impelled Nick to use these illegal medications, which he became addicted to in an effort, a misguided effort to self-medicate himself. But what these rehab programs do is they're scams for the most part. They admit you, they charge a lot of money, they detox, and they keep you for a certain amount of time, and they release you. But the aftercare is the key here, and there isn't adequate aftercare provided, and patients then relapse and becomes a revolving door. Also, if the addiction is secondary to a primary mental illness, whether it's depression, whether it's psychosis, whether it's schizophrenia, that has to be treated, or the same process is also going to continue to happen repeatedly. So somebody has to sort out what's become a complex problem, and unfortunately, our system isn't set up to do that. Nick was using drugs like heroin, but also stimulants like cocaine and maybe methamphetamine. So in addition to whatever problems were occurring from the psychotropic medications not helping and being switched in a way that left him, in an unstable situation, methamphetamine and cocaine are like gasoline to the fire of a psychotic disorder like schizophrenia. So that could have been contributing to his instability.
Do doctors, are they beholden to say that this person is teetering on the edge? We know that we are adjusting medications. We know that there are side effects he's experiencing. Does it fall on them at some point to say, we're going to force this person to an inpatient situation?
Absolutely. So they may be adults by age, but they're fully dependent on their family. They're paying for everything. They're not independently functioning. And we have rules, we have laws that prohibit the doctors from even talking to the parents. The other thing is that the rules for civil commitment or treatment of a patient over objection, or hospitalizing them over objection, are so stringent that a person has to literally commit a crime before they can be forcibly admitted to the hospital or required to take medication. What we have here as a result of the inattention to this problem, which is good mental health care and also integrating it with the potential for substance abuse, is we're introducing into our population ticking time bombs. And what comes to the public's attention through the media programs like you're focusing on here are only when the tragedies exist, and usually when it's the tragedies in notable people or notable families. And that's when it comes to the public's attention.